You feel that pain for a couple of months or maybe years, and you have been told that the pain is in your head. You just have to learn how to live with that pain, unfortunately. Can you relate to that? I think you can. So you have been told that again and again and again for a couple of times, the pain is in your head, it's completely psychological, until this kind of belief roots deep down your brain, like for good. And now you might say, is that the real case? Is it true? You want the truth, guys? No, it is not. Chronic pain is real. Chronic pain is complex. It's not like a straight line or something. It involves a large number of factors, and yes, brain plays a crucial role when it comes to chronic pain and everything, but don't let anyone belittle your pain by saying, man, it's just in your head. So, by the end of this video, you're gonna learn exactly what's going on with chronic pain and why it is not in your head. So, sit back, relax, and let's extinguish that limiting belief once and for all. You're welcome. Okay, now I'm gonna explain the chronic pain pathway as simple as I possibly can, alright? So, pay attention. You know that your body has nerves that communicate with your brain. So, when you hurt yourself, like when you took a nasty fall a couple of years ago and you hurt your back, these messages tell your brain, hey, there is a problem. What is happening is, each injury has a specific healing time frame. Sciatica, let's say for example, takes around 4 to 6 weeks to get better and fully recover. A bone fracture takes around 6 to 8 weeks to recover. So, if you had any of these kind of injuries or conditions and the pain continues to go on and on and on beyond that healing time frame, then becomes chronic. So, as you can imagine, the key player in chronic pain cases is your nervous system. It's the connection between the tissues that have been damaged and the brain. So, in normal cases now, we know that when the tissues is been normally healed, the pain goes away. However, for some individuals, they are still feeling that pain for a couple of months or maybe years, even when the tissues is been normally healed. And that's something we call central sensitization. Now I'm going to explain what is happening inside our body. So, when the pain goes on and on and on, beyond that healing time frame, it causes some neuroplastic changes in the central nervous system. And these changes change the structure of the neurons who were basically sending this kind of pain messages in the first place. We're talking about the same neurons here, right? And then over time they become oversensitive, right? Which means even the most gentle force, external force, might be painful for you, which is gonna keep your chronic pain going, right? Sometimes the brain itself gets involved and interprets this kind of signals quite differently, I will say. It's like as if your brain is still convinced that there is a problem there, even when everything has healed up nicely. But unfortunately, it's not just about the physical aspect of pain, it's also about your emotions. We know that stress, anxiety, depression can actually trigger the system with cortisol. Cortisol is like adding fuel to that chronic pain fire, if it makes sense, and the pain will be more intense. Yeah, the good news is that we can calm down this hypersensitive alarm system. It might involve a few exercises, specific techniques and approaches, yeah, but basically what we want to do here is to retrain those messages, to teach your brain that everything's fine, there is no damage, let's move on. And that's the real challenge with chronic pain. Now I'm going to create another video in terms of how to retrain those messages and shape the way the brain processes pain signals, alright? So, don't forget to subscribe if you don't want to miss out, alright? And that's all for today's video, guys. Keep in mind, chronic pain is not a psychology game, okay? It's not in your head. So don't let anyone underestimate your struggles, because chronic pain is like an opponent. If you underestimate your opponent, you're gonna lose, right? So if someone says, man, it's just in your head, it's like oversimplifying thousands of things that's going on inside your body that you should be aware of. Chronic pain can be caused by a lot of things, can be influenced by a lot of things, alright? So, as long as you are aware of this, that's always the first step towards managing it, okay? So, sit down, analyze your experience with chronic pain, okay? Because every case is unique. And in the comments down below, let me know what's your experience with chronic pain. What's your story with chronic pain? I'm happy to give you my advice. And yes, that's pretty much everything. So, I hope that makes sense, because for me it's always a bit challenging to create, physiotherapy content in different language, so I'm just trying to explain everything as simple as I possibly can, if that makes sense. Alright, so yeah, that's pretty much everything. Take care, guys.